At the heart of Siaya lies the Siaya County Referral Hospital. Located in Alego Osunga constituency, this Level 4 facility is also supposed to be a safe haven for residents with health needs from all of Siaya's 6 sub-counties. But is it? To see for ourselves if the hospital is indeed capable of handling most cases within the Lakeside County, we embarked on a tour around the facility. Our first stop was at this CT scan used to create images of the internal body to diagnose a range of different medical conditions. Common conditions diagnosed here include tumors, hemorrhages, masses, sinusitis, as well as mandible fractures. Besides the CT scan is the endoscopy unit, where tests inside a body are conducted. Normal procedures here take 20 to 30 minutes and entail a long thin tube with a camera inside being passed through a natural opening of a patient, such as the mouth. Endoscopy can be used to diagnose anemia, internal bleeding, inflammation, constipation, diarrhea, as well as some cancers in the upper digestive system. The hospital also has a refurbished newborn unit. Infants born preterm are placed in these neonatal intensive care units, where they receive the best care possible until they are able to go home with their mothers. There is also a renal dialysis center at this facility. The center serves patients whose kidneys do not filter blood the way they should, or in other words, patients with kidney failure. Further, there is an oxygen plant at this hospital where oxygen for patients who need it is manufactured. It is the only plant in the entire Lake region and 1 in 5 set up across the country. Commissioned in 2014 by former First Lady Margaret Kenyatta and run by Hewa Tele, this plant ensures oxygen is locally available and affordable to needy patients in the county and in other neighboring counties.
The CT scan has been now with us for the last almost 2-3 years, and that has made the biggest impact. Let me just say that, because the fact that it's functional means our diagnostic capacity increases. It means our surgical capacity also increases, because we diagnose more and more things. So of course now, in terms of trauma, you know we have lots of motorbikes around, there are highways around. When they come in, a patient who's really sick, not sick enough to travel by an ambulance for another 1-2 hours to get to Eldoret or Kisumu, we do that right here. Once it's done, we get the reports, we interpret something we can handle, we go in and handle.
Despite the recent advancements, Siaya Governor James Orengo, however, admits that there is still much left to do here and in other hospitals across the county to ensure Siaya people are covered.
Quite clearly, we are still not there, but we have put plans and undertaken constructions of various facilities in our hospitals. For example, at the Siaya Referral Hospital, we are building a modern surgical unit, and in that surgical complex will include an ICU, because the one we have currently, it is in an old building, an old structure, which does not give the kind of services required. It's a big construction that is going on at the Siaya Referral Hospital. But our plan for the future is completely to build a new hospital complex in the Siaya Referral. And we put some money in this year's budget to get that process going.
David Muthoka, KTN News, Siaya County.
The Siaya project